Good evening, my dear friends. Welcome to my channel. So far, we have discussed about so many spotters we have seen histology and also gross anatomy. After a very long time, again, I have come to you. Sorry for not uploading any videos because I was in research work, so I could not post any videos. So let's get started. Before going to see this video, please subscribe to my channel. So today we are going to see the spotters from the upper limb. So I have divided into different parts. So in our previous class, I have shown you the osteology part, and now I am going to show you the nerves, how to identify the nerves in the dissection practicals. So in the dissection practicals, first and foremost things which we are going to identify, we are going to find out all the muscles, vessels and nerves. The muscles which probably they ask is this pectoralis major. Let me show you that. So this is nothing but the pectoralis major muscle. So they ask about the origin or insertion of the pectoralis major and the nerve supply of the pectoralis major. And other structure which usually they ask in the upper limb practicals, if they ask about, if they wanted to ask any vein, they may ask this vein which is present in the deltopectoral groove. So this muscle is called as deltoid muscle, which we have seen in our previous class, and this is nothing but the pectoralis major. So between these two structures, two muscles, we can identify this vein is nothing but the cephalic vein. So cephalic vein, what usually they ask regarding the cephalic vein is, so what is the fascia pierced by the cephalic vein and where does the cephalic vein drains? That the question usually they ask. So cephalic vein is piercing the clavipectoral fascia and it is draining into the axillary vein. So this is nothing but the cephalic vein. Yes, coming to the cards of brachial plexus, what we are going to see here is I am going to show you the three cards of brachial plexus and the branches of the brachial plexus. Okay, so in this class, we are going to identify only three cards in the axilla and then their branches, how to identify the cards and how to identify the branches of each and every card in the axilla. Okay, so in the next class, we are going to see the branches, how they're extending into the arm and how they're extending into the forearm and how they're extending into the hand. That we are going to see in our next classes. So in this picture, we can identify the body is in the supine position. Supine position. So we are seeing the two muscles over here. So the superficial muscle which we have seen in our previous class, that is nothing but pectoralis major. Even in our first slide which I have shown you, that is nothing but the pectoralis major. So under the pectoralis major we can identify some nerves. So how to identify the nerves? How to identify the nerves? So to identify the nerves, you must remember the branches of each and every card. So what are the branches of each and every card? So three cards are there. One is lateral card, medial card and posterior card. So the lateral card branches are lateral pectoral nerve, musculocutaneous nerve, lateral root of median nerve, lateral root of median nerve. Okay, these three branches you remember, LML. It is a mnemonic to remember the branches of lateral cord. So let me explain how to identify the lateral pectoral nerve. So underneath the pectoralis major. So the pectoralis major is pierced by a nerve called as lateral pectoral nerve. So from the upper margin of the pectoralis minor, we can identify this nerve. So this nerve, which is nothing but the lateral pectoral nerve. So this lateral pectoral nerve is piercing the clavipectoral fascia and coming outside and supplying to this pectoralis major. That is how we have to identify the lateral pectoral nerve. Then the muscle which we can identify here is the triangular shaped muscle is nothing but the pectoralis minor. So from the upper margin of the pectoralis minor, there is nothing but lateral pectoral nerve. So this is nothing but the lateral pectoral nerve. Now we are going to see other nerve. So here you can identify another nerve. So that nerve, which nerve it might be, is lateral root of median nerve. Lateral root of median nerve. So how to identify the lateral root of median nerve? I will show you. So try to find out in the axilla. There will be two roots are going to join with each other and forms a trunk. So the two roots. One is lateral root of median nerve. Another one is medial root of median nerve. Both are joining with each other and forms a trunk. So that trunk is called as the median nerve trunk. median nerve trunk. Let me show you a clear picture. Yes, coming to this clear picture, in this picture we can identify clearly that these two roots are here. They are going to join with each other and forms the median nerve. This forms the median nerve. So another nerve which I'm going to show you here is the musculocutaneous nerve. So how to identify the musculocutaneous nerve is, so underneath the pectoralis minor, there's a nerve which is running laterally and is piercing a muscle. So that nerve is nothing but the musculocutaneous nerve, and the muscle which is pierced by it is coracobrachialis. Okay, so how this is how we can identify it. So the lateral chord of brachial plexus, it is giving three branches. One is lateral pectoral nerve, which we can identify at the upper margin of the pectoralis minor. Then musculocutaneous nerve, which is running lateral and piercing the coracobrachialis. And then the lateral root of median nerve, which is running medially and is going to join with medial root of median nerve. So the median nerve location will be lateral to the third part of axillary artery. Okay, so that is about the three branches of lateral chord of brachial plexus identification. So this is nothing but the musculocutaneous nerve. Then we are moving to the medial chord of brachial plexus. Medial chord of brachial plexus. So the branches of the medial chord of brachial plexus, to remember the branches names, it is also having a mnemonic called as M4U. Let me show you that. M4U means the four nerves, the names of the four nerves, they starts with M, and only one nerve name starts with U. So the four nerves which starts with M letter, they are one is medial pectoral nerve, next one is medial cutaneous nerve of arm, medial cutaneous nerve of the forearm, then medial root of median nerve, and then U stands for ulnar nerve. It is very easy. So what are the four M's? One is medial pectoral nerve, then medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, then medial root of median nerve, and then the ulnar nerve. Ulnar nerve. So that is about the four M's and one U. Now we are going to see how to identify these four nerves. Four nerves. Already in our previous slide, which I have shown you, the medial root of median nerve, Then how to identify the other three nerves, and also ulnar nerve. Okay, so other three nerves are medial pectoral nerve. So the nerve which is piercing the pectoralis minor, that is nothing but the medial pectoral nerve. Okay, so from the upper margin of the pectoralis minor, which we have seen the lateral pectoral nerve, then at the undersurface of the pectoralis minor, the nerve which is piercing the pectoralis minor is nothing but the medial pectoral nerve. Okay, let me show you that. Yeah, here it is. So this is nothing but the medial pectoral nerve. Then other nerve is medial root. Here you can identify the two roots. This is lateral root, which is coming from the lateral chord of brachial plexus. This is the lateral chord of brachial plexus. Then the medial root is coming from the medial chord of brachial plexus. And these two roots, they are going to join with each other and forms the median nerve trunk. So two nerves which I have shown you, one is medial pectoral nerve, that which is piercing the pectoralis minor. Then medial root of median nerve, try to find out the median nerve trunk, which is present lateral to the third part of the axillary artery, even in the upper half of the brachial artery, upper half of the arm, where we can identify the brachial artery, lateral to the brachial artery, which we can identify the median nerve. So just try to find out the median nerve and try to move upwards. There we can identify the two roots. So one is coming from the lateral chord, another one coming from the medial chord. Okay, so the two M's we have seen. The next two M's are medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm. Now, how to identify that? So in the axilla, in this picture, we can identify axillary artery, axillary vein. So the location of axillary vein is medial to the axillary artery. That you have to remember. So medial to the axillary artery, we can identify the axillary vein. Then medial to the axillary vein, which we can identify the slender nerve, which is nothing but the medial cutaneous nerve of arm. This is nothing but medial cutaneous nerve of the arm. How to identify that medial cutaneous nerve of the arm? So how to identify that is it has to present medial to the axillary vein, and in the most of the cadavers you may see that it is going to join with the intercostobrachial nerve. It is going to join with intercostobrachial means it is coming from the intercostal nerve. So intercostal nerve is also joining with the medial cutaneous nerve of the arm, and it is called as intercostobrachial, which is supplying to the skin of the medial compartment of the skin of the medial compartment of the arm. So that is how I have to identify the medial cutaneous nerve of the arm. Then how to identify the medial cutaneous nerve of the forearm and ulnar nerve? That is also very easy. Here you can identify this is red color one is axillary artery and this blue color one is axillary vein. So between these two structures we can identify the two nerves. One is anteriorly or superiorly we can identify medial cutaneous nerve of the forearm. Yes, here you can see that. So this is the axillary vein, and then between the axillary vein and the axillary artery, superficially we can identify the medial cutaneous nerve of the forearm. Medial cutaneous nerve of the forearm. Then we can identify below that medial cutaneous nerve of the forearm, thick nerve which we can identify that is nothing but the ulnar nerve. Ulnar nerve. So try to remember once again. So the medial cutaneous nerve of the forearm is present superficial, and it has to present between the axillary artery and the axillary vein. Okay, and below that medial cutaneous nerve of the forearm, the thick nerve which is called as ulnar nerve. Then how to identify the medial cutaneous nerve of the arm? It has to present medial to the axillary vein. Medial to the axillary vein. That is how you have to identify the 5 branches of medial cord of brachial plexus. So what are the 5 branches? One is medial pectoral nerve. How to identify that? It has to pierce the pectoralis minor. I try to identify here. So it is piercing the pectoralis minor. That's how we have to identify the medial pectoral nerve. Then medial root of medial nerve. In this picture, you can identify here it is. Is a Y shape. Can you identify? So this is nothing but the lateral root of medial nerve, and this is nothing but the medial root of medial nerve. Okay. So 1 and 2 and 3. Third one is medial cutaneous of the forearm and the ulnar nerve, which are present between axillary artery and the axillary vein. Medial to the axillary vein, that is medial cutaneous nerve of the arm. So that is how 5 branches which are coming from the medial cord of brachial plexus. Then the posterior cord. How to identify the posterior cord of the brachial plexus and how to identify the branches of the posterior cord of brachial plexus. So the posterior cord is present posterior to the second part of axillary artery. Posterior to the second part of the axillary artery. So the nerves, how to identify the nerves of the posterior cord. So what are the 5 nerves? What are the branches coming from the posterior cord? Are 5 branches which are coming from here also. So from the medial cord 5 branches, and from the posterior cord also 5 branches. Okay, so what are the 5 branches are? There is a mnemonic to remember the branches names, that is called as ultra. U stands for upper subscapular, L stands for lower subscapular, T stands for thoracodorsal, R stands for radial, and A stands for axillary. Let me show you how to identify that. So the first and foremost nerve, which is called as upper subscapular and the lower subscapular. So this upper subscapular and the lower subscapular, they are coming from the posterior cord of brachial plexus. They are running down and then posteriorly, and they supplies to the subscapularis muscle. So the upper subscapular nerve, which is supplying to the upper part of subscapularis, and then lower subscapular. Let me show you that. So this is the upper subscapular nerve. Can you find here? This is a small slender nerve which is running downwards and supplying to the upper part of subscapularis muscle. Then here you can identify the lower subscapular nerve which is supplying to the lower part of the subscapularis muscle. Lower part of the subscapularis. Then the third nerve is the thoracodorsal nerve. So this thoracodorsal nerve, which is running from the posterior cord of brachial plexus, it is arising from the posterior cord of brachial plexus, and it is supplying to the latissimus dorsi muscle. Latissimus dorsi muscle. This is thoracodorsal, and it has to supply to the latissimus dorsi muscle. So the nerves, if you find any nerves which are supplying to the subscapularis, that might be definitely, most definitely, they are upper subscapular and lower subscapular. If the nerve is supplying to the latissimus dorsi, that is nothing but thoracodorsal. And then next one is axillary nerve. So here I'm not showing you the radial nerve. I'm going to show you in the next picture, but here you can identify the axillary nerve. So how to identify the axillary nerve? So small part of the axillary nerve we can identify in the axilla, then it is a small part we can see here, then it is disappearing by entering into a space called as quadrangular space. So the quadrangular space, it is going to enter into the quadrangular space, and then it is encircling the surgical neck of the humerus. And this, the nerve which is a small part of the nerve, if you find that and it is entering into the quadrangular space and it is disappearing, that is nothing but the axillary nerve. Okay, this is here, you can see that axillary nerve is over here. Yes, that is the axillary nerve, and it is running along with the posterior circumflex humeral vessels. If any artery which is running along with this nerve, that is nothing but, there is a small branch, which is coming from the third part of axillary artery, so that is nothing but the axillary nerve which is running along with the posterior circumflex humeral artery. Then the last one is the radial nerve, which I have not shown in the previous picture. Now I'm showing this radial nerve. So this radial nerve, which is coming from the posterior cord of brachial plexus, behind the third part of the axillary artery, even second part as also we can identify this radial nerve. So this radial nerve, which is leaving the neurovascular bundle immediately, after coming from the posterior cord of brachial plexus, then it is running downwards and enters into the lower triangular space. So that is nothing. Here you can see that radial nerve. So this is the radial nerve. Okay, so how to identify the radial nerve? So try to find out the triangular spaces. If it is present in the lower triangular space, that is nothing but the radial nerve. If it is present in the quadrangular space, that is nothing but the axillary nerve. Okay, so that is about the branches of posterior cord of brachial plexus. So in this class, we have seen how to identify the cords of brachial plexus and how to identify the branches of each and every cord in the practical examinations. Okay, thank you, dear students. With a new class, we are going to gather once again. Thank you, dear students. See you soon. Bye.